Text, safely keeping baby warm. A Q&A on bedding, clothing, and sleep-related infant death. Logo, Safe to Sleep. Logo, Department of Health and Human Services USA. Logo, NIH, Eunice Kennedy Shriver National Institute of Child Health and Human Development.
Thank you for tuning in to learn about safe infant sleep with the Safe to Sleep campaign.
Text, Lorena Kaplan, MPH, MCHES, moderator. Lorena addresses us with a virtual background that shows a large white bookcase with decorations. She is wearing a light blue blazer over a white top. She has dark hair pulled back into a ponytail.
Safe to Sleep is a nationwide effort to educate parents, caregivers, health, and other service providers about reducing the risk of sleep-related infant death. I'm Lorena Kaplan, and I'll be your moderator. Joining me is pediatrician Dr. Rachel Moon, a leading expert on sudden infant death syndrome, or SIDS, and safe infant sleep. She is the Harrison Distinguished Professor of Pediatrics at the University of Virginia School of Medicine and Health System, and chair of the Task Force on SIDS at the American Academy of Pediatrics, or AAP. Thank you for joining us, Dr. Moon.
Text, Rachel Y. Moon, MD, American Academy of Pediatrics Task Force on SIDS. Rachel addresses us from an office. She has a blue top and has shoulder-length dark hair.
Thank you for inviting me to talk about this important topic. As you know, one of the central responsibilities of the AAP Task Force on SIDS is to review the most recent evidence about risks of sleep-related infant death and then develop recommendations to help caregivers reduce these risks. We released updated recommendations in 2022, and I'm happy to be here to share some of the highlights with your audience.
And to our audience, if you want to follow this discussion alongside AAP's guidelines, links to the 2022 AAP policy statement and to the Safe to Sleep website are available in the description of this video.
Text, safetosleep.nichd.nih.gov.
Because the science that informs the AAP recommendations can be hard to follow, we're taking this time to highlight what's new. We have a lot to cover, so let's get started. Dr. Moon, as you well know, one common question among caregivers is, how do you safely keep a baby warm and comfortable while they sleep? The 2022 AAP recommendation says, avoid overheating and head covering in infants. Could you please talk us through the reasons behind the recommendation and suggest ways for parents and caregivers to practice it?
Avoid overheating and head covering in infants.
Absolutely. Research shows that babies who get too hot are at higher risk for SIDS, and there are two potential reasons for this. One is that babies' bodies are just learning how to control their temperature, and it could be that once they get too hot, they can't cool down the same way adults can. Or the body system that keeps them breathing doesn't work as well when they're too hot. The other potential reason is that blankets and extra coverings that are used to keep babies warm can be a suffocation risk. So the AAP recommends that instead of using loose blankets, you use a wearable blanket for the baby, or put extra layers of clothing on the baby if you're worried about them getting cold. And this is a new part of the recommendation. Babies shouldn't wear hats indoors. Hats are not needed inside for most babies once they come home from the hospital, because hats can make baby too hot. And there's also the chance that the hat can cover the face, particularly the nose and mouth, and make it harder for the baby to breathe. So when dressing the baby for sleep, we want the baby to be comfortably warm, but never hot.
Thank you, Dr. Moon. Let's dive a little deeper into that advice. First, I would love to hear a little more about what caregivers should do when dressing baby for sleep.
Of course. So you start by thinking about the temperature in the room where the baby is sleeping. The AAP recommends that babies sleep in the same room as their caregiver or caregivers until they're 6 months old. So let's use that as an example. What would you wear to be comfortably warm in that room at the temperature that your room is at? You want to dress your baby in at most one more layer than you would wear to be comfortable.
Image, a woman sets her child down in a crib.
So if you would wear a long sleeve t-shirt to stay warm in your bedroom, you may want to dress the baby in a long sleeve t-shirt over an undershirt. Dressing the baby in too many layers is called overbundling, and this could cause overheating, which is when the baby's body temperature rises to a level that could be dangerous.
Text, overbundling, when baby is wearing too many layers of clothes for the room temperature.
Remember, babies are only just learning how to control their bodies, so to balance keeping the baby warm but not too warm, dress them in at most one layer more than you would wear to be comfortable.
And just so we're clear, if baby does get too warm, what would that look like?
A bullet point list.
An overheated baby might be sweaty, clammy, or have warm, flushed skin. If the baby's chest is hot to the touch, that's also a sign of overheating. These are important things to look for so that the caregiver can help the baby cool off by removing a layer of clothing or moving to a cooler area.
Thank you. That's helpful advice. It's good to know the signs of overheating so we know what to do to keep babies safe. Now, you mentioned wearable blankets. What are they and how should caregivers use them?
Text, dress baby in a wearable blanket or an extra layer of clothing.
Wearable means that the blanket has sleeves or armholes so the baby wears it like clothing. Wearable blankets zip or snap securely into place on the baby's body as a top layer of clothing.
Image, a baby asleep in a crib with a wearable blanket. There is a zipper down the middle. It covers the baby's feet, but the arms are free to move.
This way, the baby's head and face remain uncovered even if they move around or roll over. And a baby can also freely move their arms so that they can more easily get themselves into a comfortable position.
Would a regular blanket laid over or under baby but tucked in under the mattress be the same thing?
Actually, no. A regular blanket, even when tucked in under the crib mattress or under the baby, is not the same as a wearable blanket. Loose or soft blankets or other clothing like crib bumpers and pillows should stay out of the sleep area. Even if they're lightweight or tucked in, these items increase the risk for injury and death from suffocation, strangulation, and other causes, especially if they become untucked and cover the baby's face. In a study from the Centers for Disease Control and Prevention, they found that between 2011 and 2014, of the 250 infant deaths classified as accidental suffocation during sleep, 190 of these deaths were linked to soft, loose bedding, like blankets covering the baby's mouth and nose.
Text, keep baby's nose, mouth, and face uncovered during sleep.
So the AAP recommends properly fitting wearable blankets as a safe way to keep the baby warm without adding risk for suffocation or strangulation.
That's a good reminder, Dr. Moon. Now, in terms of the sleep environment, keep everything out of the crib or sleep space except a fitted sheet for the mattress and a comfortably dressed baby. The recommendation specifically says to keep baby's head uncovered while indoors.
Keep baby's head uncovered while indoors.
For example, babies shouldn't wear hats when they're inside the home and especially not when they're sleeping. Can you tell us more about this new guidance?
Of course. For many people, hats are a classic part of the image of a newborn, and many hospitals still provide hats for babies to wear in the first few hours of life. Studies show, however, that head coverings increase the risk of SIDS. This could be related to hats leading to the baby overheating. Also, if the hat becomes loose or comes off during sleep, it could cover the baby's face and increase the chances of suffocation and strangulation. One study suggested that not using head coverings during sleep might reduce the risk of SIDS by more than 25%. Newborn hats can be a nice reminder or memento of the baby's first day, but it should sit on a shelf or in a scrapbook and not go on the baby's head.
The information you shared with us today is so important. Thank you, Dr. Moon.
A checklist. Text, recap.
So just to recap, to reduce baby's risk of SIDS and sleep-related death, keep baby warm, but not too warm, use a wearable blanket instead of a loose or a tucked-in blanket, dress baby in at most one layer more than an adult would wear to be comfortable for the temperature of the room, and leave baby's head uncovered, so no hats while indoors. Is that right?
Absolutely right.
Excellent. To learn more, visit the Safe to Sleep website, linked in the description of this video. And remember, when it comes to baby sleep space, keep it bare, keep it safe, keep it simple. Thank you for joining us. Bye for now.
Text, thank you for joining us. Logo, Safe to Sleep. Logo, Department of Health and Human Services USA. Logo, NIH, Eunice Kennedy Shriver National Institute of Child Health and Human Development.